This is a summary of U.S. Surgeon General Dr. Vivek Murthy, Efforts and Challenges in Promoting Public Health from the Hubermanlab podcast, where we break down the key insights, ideas, and takeaways from this content, giving you the gist so you can decide if you want the rest. Dr. Andrew Huberman interviews Dr. Vivek Murthy, the U.S. Surgeon General, about the most pressing public health issues facing the nation, including mental health, nutrition, social media, and corporate influence on public health policies. Dr. Murthy explains his role in overseeing the U.S. Public Health Service and how his team addresses both acute emergencies and chronic health issues. The discussion emphasizes building a health-focused society rather than merely preventing illness. The discussion explores the two primary roles of the Surgeon General, engaging with the public and overseeing the U.S. Public Health Service. How corporate interests, big food, big pharma, influence public health messaging. The global crisis of loneliness and social isolation. Challenges in rebuilding public trust in science and public health institutions. The need for a proactive approach to health, not just a reactive one. The Surgeon General's office engages with the public to provide scientific information on improving health and reducing illness. The U.S. Public Health Service comprises over 6,000 officers, including doctors, nurses, pharmacists, and engineers, who address public health threats domestically and internationally. Dr. Murthy emphasizes that his role is independent of political agendas, guided by science and public interest. Key public health issues discussed. 1. Mental health crisis. A significant portion of the U.S. population reports feeling lonely or isolated. Loneliness increases the risk of cardiovascular disease, dementia, and premature death. Dr. Murthy highlights the importance of building human connections and providing social support. 2. Nutrition and food policy. Processed foods with high sugar and sodium content contribute to health problems. The lack of long-term studies on food additives and their impact on health is concerning. Economic and geographic disparities prevent many Americans from accessing healthy food. Policies should aim to make healthier foods more affordable and accessible. 3. Public health messaging and trust. The COVID-19 pandemic eroded public trust in health institutions. Poor communication and conflicting messages during the pandemic contributed to public distrust. Dr. Murthy advocates for humility and transparency in public health messaging, acknowledging when mistakes are made and clearly explaining the rationale behind recommendations. 4. Social media and technology. Excessive social media use contributes to social isolation, particularly among youth. The need for regulation to ensure social media platforms are not harmful to mental health. Parents should work together to delay social media exposure for their children. Corporate influence on public health. Public health decisions should be independent of corporate interests. The pharmaceutical industry, food companies, and social media platforms often prioritize profit over public health. There is a need for stronger regulations to prevent industry interference in health recommendations. Challenges in implementing change. The bureaucratic process of distributing funds and resources hampers timely public health responses. Insurance companies often create barriers to accessing mental health care and necessary medications. Resistance from powerful industries that could be harmed by new public health initiatives. Proposals for improvement. 1. Better communication channels, developing efficient ways to inform the public about health risks and preventative measures, ensuring health messages are accessible to diverse populations, making public health messaging independent of corporate funding and interests, ensuring accurate, science-based information is disseminated without bias. 3. Improving healthcare access, creating interdisciplinary teams to provide comprehensive care for patients, streamlining insurance processes to ensure timely access to essential medications and therapies. Vivek Murthy emphasizes the need for rebuilding public trust in science and health institutions by improving communication, transparency, and accessibility. His vision includes a health system that proactively promotes well-being rather than simply treating illnesses, Addressing loneliness, ensuring equitable access to health resources, and mitigating corporate interference are crucial steps toward achieving a healthier society. That's a wrap on U.S. Surgeon General Dr. Vivek Murthy, Efforts and Challenges in Promoting Public Health. If you found this summary valuable, make sure to follow, subscribe, and come back for more in-depth breakdowns of content.